your membership and who you represent.
Sure. District Council 37 is the largest municipal employee union, representing 150,000 employees and about 100,000 retirees. We represent the gamut of city workers, as we like to say, from architects to zookeepers. Secondly, we're going to really look into negotiations for healthcare, because we have seen a lack of access of healthcare across the system. It's going to be critical for people, especially people who are elderly, in retirees that are going to be seriously affected by that. So healthcare is going to be a major piece of it. Personally, I think that I've also looked to lead by example, trying to re-envision our staff and the way we handle and the way we service members. We provide prescription drugs and benefits to over 380,000 people, which is critical. So we can't afford to be out, be sick. And so we're going to try to minimize exposure.
UFT, other unions, because this is this MLC issue, but it's really about us saying, you know what, other unions may want to be involved with this process, but for us, it's not a may. We will be involved with this process. And knowing that 3 years from now, that there is no premiums on the table, because now the city has said, if you can do this, and if we can get the 20% back, we will absorb. We know that that $600 million that we were going to spend now is going to go into your welfare fund, the city's welfare fund, which serves us and pays for our benefits. And what does the city get out of that? They get a fixed cost. They know what their cost is for the next 3 years. And that's all. That's what is a great comfort to somebody running a city. This is the cost. It's not going to go up. This is it. But now it's really about us doing something, that people have not done across this country. We've designed our own Advantage program. We've designed to meet the needs of our retirees and all retirees of New York City. And once again, we don't have issues with taking on the responsibility of holding people who have contracts with us responsible for what we know we are now entitled to. And that's what this is about. So we want to get you the information you need. There was an alarming spike in healthcare costs in across the board, our retiree healthcare plan, everywhere else. And that's really been what this process has been about. It's been about taking control. It's been about changing the paradigm of how we go about making sure that we're getting the best healthcare for ourselves, that's in service, and our retiree members, and really starting to tackle this out of control healthcare cost crisis that the entire country is facing. And I remember at that point in time, we were about 2 months before the pandemic, where they said that we're going to have to put co-payments on the retiree healthcare because if not, they were looking at doing something very substantial in terms of saying, we have to even start thinking about putting premiums on their table. And at that moment in time, the MLC was really said, listen, we'll do what needs to be done for right now, but we're not playing on this field anymore under these rules. We're done. We're absolutely done, because we're basically marching to a place where it's just going to be more and more money out of our own pockets. It's going to be premiums that every year are going to be percentages put on it over and over again, and not just for our retirees, but also for our in-service folks. And that's really where this process began, about saying, all right, we need to learn more about this. We can't just be relying on consultants. We have to really dig into this and learn a lot about everything. And the first one I said we have to stabilize firstly is our retiree health care. Next year we have to tackle our in-service health care. We have to stabilize our retiree health care. We cannot be sitting here 3 years from now and dealing with massive premiums, new administration coming in at that point. That's what we were thinking 2 years ago. And then the pandemic hits. And thankfully, not thankfully, but because of the pandemic, we went to the city, we went to the insurance companies. We said we have to push those premiums off right now, the co-payments. We have to push the co-payments off because we're now in a pandemic. Everybody agreed. But then throughout that, we said, we have to continue to do the work of this process. We cannot continue to, the city's position was, we cannot continue to absorb 20% of all the healthcare costs, which we are paying for, of the retirees, not just of the UFT, but of the entire city retiree workforce. That was a big, and we saw the costs escalating at a rapid rate. And it didn't matter, this administration be out of here. We knew the next administration coming in, this would be the first thing they'd put on the table. You all know this, you've lived through how many times we've had a crisis in our healthcare coverages. So it really was about that, about how do we get smarter, but also at the same time, do what we've always done as a union, start taking more control over this entire process. Believing in each other that if we have real information and we have constant communication and we figure out a way to have leverage and a way to get things changed if we're not getting what we were promised, we have all of those things in place, then we know we can take control and get to a better result. And that's the process we're in right now. And you know, this process, like every other thing in the United States, every other thing in the city at this point, a lot of different facts that aren't facts out there. But for me, and for us, and for the MLC, it became, all right, city, we're going to do something. We're not going to do what you want. We're going to figure out how to do a healthcare plan that nobody else in the United States has done. And our folks figured out very clearly that how do we get that 20% back? How do we get reimbursed by the federal government for that 20%? And that meant we had to go into the name we hate, a Medicare Advantage system.